So today I am thrilled to be here with Kathleen Noonan. Kathleen is the president and CEO of the Camden Coalition. So Kathleen, thank you so much for making yourself available to us.
Thanks for having
me.
We're
so grateful. Let's just start by talking about you a little. I know you don't like to do that, so I'm going to push you a little bit, but tell us about where you grew up, where you went to school, that kind of.
Sure. So I grew up in Long Island, and I landed in Philadelphia because of my husband's job. He teaches law at Temple, and I spent 10 years at the Children's Hospital of Philadelphia, and then had the opportunity to come to South Jersey and work in an incredible local organization.
Okay, well, you brushed over the CHOP stuff, so I'm not going to let you go back. CHOP obviously is the Children's Hospital of Philadelphia.
Yeah.
I mean, you didn't just work there. You guys set up the policy shop, which really then, while you were doing the work at Camden Coalition, was actually the lead for the nation talking about the COVID work in reference to all of the data. So just spend a minute talking about that.
Sure. So in 2008, or 2007, I met a pediatrician at the Children's Hospital of Philadelphia, Dave Rubin, and he was very frustrated that the research that he was doing, mostly on low-income families, he was finding great things and he wasn't able to implement it. I was an implementer out working with state and local government agencies, really in very big turnaround situations. And when we were there, we did amazing work because we said, if we're getting these research dollars to do a community-based intervention, then we shouldn't do it within the walls of CHOP. Yep. We should go out and find community partners and do it with them. And so we just did all these really different things that were amazing, and that resulted in actually more resources and not just research findings.
And that then led you
me to the Camden Coalition.
Which is where it seems like there's the nexus of all of those things.
Well, the Camden Coalition was really interesting to me because they were a small organization that was involved in a big study, a randomized controlled trial. Really hard for a small organization to be involved in something like that. And I knew from being at CHOP that we had extensive research in cancer care and heart disease and all sorts of different things, but we did not have a lot of research in how do you actually engage very, very complex families and kids. Yep. And so to me, I kept saying, it doesn't matter what the research says, this is an amazing contribution to the field. Right now we're working in the 5 counties, it's 1.5 million people. 1 in 5 of them are on Medicaid, right? Which means they're getting their health insurance from a public system and that they do not have a high income. And I really have found in South Jersey, a real interest to work together. And I think the Camden Coalition also, started our work very much in care management with patients, but expanded it into how do we build the systems around these patients? And that's what we've been doing with hospitals like yours for now. It's our 20-year anniversary this year. So
that's amazing.
Yeah, we've been around for a while.
Those lessons learned from the early work have really been helpful. And then, of course, you've continued to evolve. I mean, the data that you have, and more importantly, the expertise that the coalition brings, has the ability to really refine the data in ways that we can't see across our own organization often, just because we're too busy doing the work.
Right.
And maybe you could spend a little bit of time about how you've helped us see some of those things.
Sure, yeah. I come to this always with the knowledge of what the health systems can do, and then where the community-based organization can sort of leverage, if you will, its sort of unique role to be able to pilot something or start something that then the health systems will actually take on and run with. So an example is we are working with all of the health systems right now on a maternal mortality project, and we are working side by side with your staff in 10 emergency rooms in the 5-county South Jersey area that we work in. And what we're doing is we're going back to the roots of the coalition, which is to look at who comes to the emergency room for care that maybe you or I wouldn't go to the emergency room for. And is that maybe some signal that they don't have regular care.
Right.
And so we are actually looking at all of the people who come to the emergency room who test positive for a pregnancy screen, and then working with all your emergency rooms to actually change the way you all do business, which is to not just say to someone, okay, this is what you do after the emergency room about what you came to us for, but to say, do you have a prenatal care appointment scheduled?
Something that simple.
Something that simple, right. And it is, I am talking hundreds and hundreds of people across these providers, and it's every provider, right? And you know, the truth is that when you say out loud, well, isn't it standard of care that someone leaves the emergency room and has a prenatal appointment scheduled? The answer is no.
Right.
So that's what we've been doing with Inspira. We've been working with, we always look to see who your partners are. So we're also working with Complete Care,
which is the federally qualified health center in our region.
Yep, and looking to see that you both are actually leveraging each other's strengths. And we've seen, you know, sort of amazing things. And let me just give you two examples of stories right out of Inspira emergency rooms. A woman in an emergency room is new to New Jersey, doesn't have insurance yet, but she tested positive for pregnancy, but she was in the emergency room for something else.
Got it.
Did not have money for her prescription that she needed. And because of this new workflow between you all and us, she got her prescription, she got the prenatal care she needed. We've set up to make sure she has transportation. Another woman, she was trying to go to prenatal care, but walks an hour each way to prenatal care.
I mean, that's the difference between being in the inner city of Camden, where the services are right here, and being in the bottom of Cumberland County when there's no transportation available.
Right. And so, again, because we picked up the pregnancy test in the emergency room, and we have created some flexible funds that are available for things like transportation, you know, we now have a transportation plan for this person. And when you look at the maternal mortality numbers in New Jersey, which are much worse than many, many states.
I know it's hard for people to imagine. I'm going to stop you right there because they're like, wait a second, women die during child? What are you talking about? I thought nobody died. So talk just a little bit about sort of what we've seen, and it's a nationwide issue, not just a New Jersey issue, but our numbers are of greater concern, especially here in South Jersey.
Yeah, I would say Cumberland, Salem, and Camden are neck and neck for the lowest rankings. And you know, we know that those rankings are driven by low wages, low employment numbers,
mortality rate that's
mortality
very high
rates,
before they should pass away.
People who are very sick, and because of their life circumstances are prone to sickness, right? They're not as healthy just as a matter of like where they grew up, environmental situations. And so we are really working to change that.
And hence, that's really I think, the foundational elements of what happened in reference to getting this to be taken nationwide. So talk a little bit about that story, because it's just amazing. I think, you know, those of us who are Jersey-centric are like, oh no, we created that. Like that, what are you talking about? There are other people involved. So spend a minute or two there.
Well, the Camden Coalition started its work back in 2002, and although now, you know, at least a lot of people in the health world are talking about social determinants of health, which are other things that drive your health other than health. At the time, you know, not everyone was talking about that. So the Camden Coalition was talking about that. And we were also talking about going outside the walls of the hospital to help people, right? Really using community health workers, having nurse, social work, and community health worker teams go and meet people. And so we were doing that very, very early. And over time, as we refined how we did this, Robert Wood Johnson Foundation actually said, you know what, we really want you to actually take this national. And we want you to develop a national center that will bring people together who are doing this work or trying to do this work, you know, and I'm talking 700-800 people from around the country to come and talk about how they are meeting the needs of adults, children, families with complex health and social problems. So it's It's fabulous. It's
Well,
really great.
And again, Robert Wood Johnson Foundation is their whole core mission is about improving the health of communities, right?
Yeah.
And they've spent a lot of time and a lot of research and a lot of money trying to look at that. And the piece of it that's often missing is in the implementation. So it
Yeah.
seems like just the perfect solution in reference to really taking this to the next level, not just to do more programming, but to actually make that huge difference, that we start to see that progress.
Yeah, I mean, I think, and we do the work by actually talking about it, but we also go into other communities and do it, right? Because we are not just, we don't just care about the research or the numbers. Like, we want something different when we leave.
Well, I am so grateful to you for all of the work that your Camden Coalition does, but also all the research and work you bring to us in South Jersey. And I'm really confident about the opportunity that we have to improve the health for everybody. And it's not going to be one thing. It's going to take a lot of little things to really gather that.
Yeah.
So thank you so much for your time today. I'm so
thank
very
you
grateful.
for having me.
My pleasure. Thank you.
Right.
Thank you so much for joining us, and we look forward to being together again. Until we meet again, be well and stay safe.